Hi guys, today we're going to talk about another research article I was reading. This one here was done by Dr. Sullivan and a few of her colleagues. Essentially, this article talks about the process at which children or adolescents are returning back to school after they sustain a concussion, but more so what the parents' perspective is on this aspect. So there's a couple of things that were kind of highlighted in this article that are I find important to note. One of the things is the parents seem to think that the child doesn't have good kind of direction with regards to how much rest or when they should return to school. Another thing that was brought up is that they're not getting great support with regards to the healthcare team in giving them guidance in when to do these things. So having a clear, kind of laid out process would be much more appreciated, that's for sure. But as the healthcare providers themselves, one of the things that we should always make sure is that we're giving clear, concise information to the patient, which is backed up by science in terms of kind of giving them the proper kind of strategies in terms of how long they should sit out, how they should start to reintegrate, when they should kind of pull back from certain things. That would be super helpful based off of kind of, I guess, the parent's perspective here. Another thing that is kind of being seen here is that when the children or the adolescents are going back to school, they might not be utilizing all of the things that are at their disposal to help themselves during that recovery period. So as parents, one thing would be good to potentially, even though you have that doctor's note or that medical note that's kind of telling the school association, here are the things that would be helpful for my child. If you could kind of follow some of these recommendations, that would be great. But you as the parent would be maybe to follow up and see what kind of strategies are set in place with your current school board and making sure that your children kind of really understand what is available to them, and hopefully also making them understand that utilizing these strategies should not be frowned upon. It's really helpful to use these things. It'll give their heads a little bit more time and a little bit more leeway so that they can function better, so they can kind of make it through the school year without so many hassles, and it'll also kind of facilitate the recovery process as well. If you're looking for this article, I'll include the link with the post.